All right. Good afternoon, everyone. Thank you again for joining us for the Preparing for the 13th Annual Southern Obesity Summit webinar, an introduction to the diverse systems driving obesity. We are at 1 o'clock, so we are good to get started. Before we dive into the webinar, I do wanted to make some announcement for a couple of quick housekeeping items. The webinar is being recorded and a link will be available post the webinar completion. All participants are on mute. Please use the chat box or the Q&A window at the bottom tab for sending any of your questions during the course of the webinar. We do have sufficient time towards the end to answer your questions. But if you have any difficulties hearing us or seeing our slides, please do send us a quick comment using the chat box window. Again, at the bottom of your screen, there is a tab which has both the chat box window and the Q&A. Again, as I said, that towards the end of the presentation, we have built in sufficient time to answer your questions or concerns regarding the presentation as well as participation at the upcoming 13th Annual Southern Obesity Summit. Also, before we begin, I do want to thank our partners at the Tobacco Settlement and Endowment Trust in Oklahoma for being our host for the 2019 Southern Obesity Summit. And next slide, please. So again, thank you again for joining us. I am Ankit Sanghvi, the Executive Director here at Texas Health Institute. We are the Public Health Institute in Texas, an independent, nonpartisan organization. I'll be sharing a little bit more about us as an organization, our focus on obesity prevention and the efforts moving forward. Joining me will be our co-director for the Southern Obesity Summit, Dr. Kenneth Smith. You'll be hearing from him shortly as well. Just to give everyone an overview for what we have built in for the next hour of your time, we will be quickly giving an overview about Texas Health Institute and our focus on obesity prevention. I will kick off the discussion on introducing systems approach into obesity prevention, which is what we are excited about as part of our agenda and planning for this year's summit. Then you will hear from Dr. Smith about the different systems and help get a better understanding that relate directly or indirectly towards driving the obesity epidemic. We'll give an illustrative example for what do we mean when we say systems approach and how does that tie to your work. And then we will specifically talk about the tracks for SOS 2019 and our objectives as we move towards the planning of what looks like an exciting summit this year. And then, as I said on the previous slide, we will have time for discussion or answering your questions. Next slide, please. So before we delve into Southern Obesity Summit and talking about systems approach, can we go to the next slide? A brief overview about Texas Health Institute. As I said, we are an independent, nonprofit, nonpartisan public health institute here in Texas. We have been in existence since 1964. Our vision is of healthy people, healthy communities, and a mission to advance the health of all. And we achieve this through our multi-pronged strategic approach, what we define as our value proposition, that is all across the different areas in the public health and healthcare spectrum. We work on producing evidence and ideas, thus furthering the culture of evidence-based, data-driven decision-making. Complementing that is the piece of sense-making, and where we translate and share insights, turning data and evidence into action. And ultimately bringing it all together is our third strategy of advancing collaborative action, again, with the thought that none of us can do it alone. And also being an independent, nonpartisan public health institute, we acknowledge that as our value of being the ideal entity of bringing different or diverse group of stakeholders together to not only agree on a common agenda, but provide the support and resources needed to be successful as we move towards that common goal. Next slide, please. Again, as I said that, I think so we skipped one in between. As Ken is helping us transition to the slide, as I said that we have been in existence for since 1964. We work across several different areas. Currently, we focus on 9 different focus areas in the healthcare public health spectrum, ranging from community health, training and e-learning, health equity, primary care, oral health, public health genomics, transgender health, emergency preparedness, and obesity prevention. Southern Obesity Summit has been our key activity or initiative that falls within our obesity prevention focus area. Just for a quick overview or historical background about Southern Obesity Summit, this has been an initiative that we have been engaged in from the get-go since 2007, where we initially partnered with our partners in Arkansas for the kickoff summit, with support from the Robert Wood Johnson Foundation as part of the Southern Rural Access Program. Since then, the summit has only strengthened year by year. And as I shared in the first slide, we are excited and looking forward towards convening our partners across the 16 southern US states for the 13th annual Southern Obesity Summit this October in Oklahoma. Moving towards the next slide. So as we talk about a new approach to obesity prevention, and this is something that our new vision and mission has allowed us, is to bring a systems lens to all of the work, not only on obesity prevention, but across all the different areas that we work on here at Texas Health Institute. And when I do say systems lens, it's important to set the context of what does that mean in the story as we move forward, and how that is going to help us with our decision making, as well as planning and implementation of all of our efforts here at the Institute, but for the numerous efforts that we are fortunate to partner or be involved with within our state, as well as across the country. So as we talk about, and you will hear more in the next few slides as Ken delves into the systems understanding of what drives the obesity epidemic, we are bringing a systems approach such that we are able to take a step back and think about the issue and what's causing the issue, or what's stopping us from effective implementation of solutions by a systems lens. So not just thinking from a community standpoint, but thinking community, financial sustainability, policy, environment, individual behaviors or decision making. And then as we try to understand that, we are intending to provide an overview or a good description about all the diverse systems that are driving the obesity epidemic specifically, and what can we do about it. Towards the end, we also want to share and set this into context, that how does this help us tie our work within the Southern US or even outside of tying into the systems understanding, and how can we address the obesity epidemic together as a community, and also have some of these discussions at the upcoming summit in October. So now I would like to invite our next presenter and our co-presenter for my co-presenter for today, Dr. Kenneth Smith. He is a senior health policy research analyst here at the Institute, and also co-directs the Southern Obesity Summit with our Director of Events and Educational Offerings, Ms. Stephanie Andreas. Dr. Smith's prior work has involved convening and supporting national level work groups and coalitions to help build healthier communities through policy, systems, and environmental change. He's a recognized expert in chronic disease prevention and a longtime member of the Society of Organizational Learning. And Dr. Smith incorporates systems thinking in research, training, coaching, and consulting. So Ken, it's all yours.
Thank you, Ankit. Let me just start out by saying that obesity is a global epidemic, and we are seeing increased rates of obesity and overweight all across the world. It's a global phenomenon. And let me just say that unfortunately, no nation at this point has actually reversed the obesity epidemic. In the US, the American Medical Association has officially recognized obesity as a disease. And what we see here is that the rates are stabilizing, but they're stabilizing at a high rate of prevalence, like over 30% of people overweight and obese. We haven't reversed it yet. And even while in some places there might be some stabilization for some population groups, we also see an increasing number of disparities across race, ethnicity, income, social class, as well as regional disparities. And one of the reasons that we began the Southern Obesity Summit was to develop a regional strategy for addressing obesity in the southern states, which is really ground zero for the obesity epidemic. Now, this is a very useful quote that I always like to talk about. First of all, obesity has been recognized as a complex problem that requires broad systems perspectives And in its influential report, Bridging the Evidence Gap, the National Academy of Sciences recommends a systems approach to the obesity epidemic. They say that obesity is a multifaceted problem that warrants a broad systems perspective to frame the problem, understand potential causes, identify critical leverage points, and take effective action. Now, there have been quite a few books and toolkits and trainings around obesity from a systems perspective since that time, but it hasn't really taken off the ground in the US like it has in other places. And we're hoping that this coming Southern Obesity Summit will offer an opportunity to widen the use of systems approaches to address the obesity epidemic. But first of all, what exactly is a system, and how do you apply it to prevention of obesity? Now, a system is defined as an interconnected set of elements, and that could be people, organizations, institutions, that are coherently organized in a way that achieves something. That is, a system is a whole that's greater than the sum of its parts, and it serves a function. So an elephant, like all human organisms, are also systems. You can't really understand an elephant by just looking at its parts. And so the key site in this parable about the elephant and the 6 blind men is that one single perspective, or multiple perspectives even, is not really enough. You need to know the entire context to understand a complex problem. The obesity epidemic, just like this complex elephant, in this case, we look at it through our own particular lenses. So you see the blind man looking at the tail and thinking that's a rope. In a similar way, we oftentimes look at obesity from our perspective as clinicians in the clinic seeing kids with obesity, and how do we change obesity for those children, or as a public health department, or maybe as someone like a public health practitioner. But you're doing it oftentimes in isolation if you don't understand the whole picture. And what the systems approach suggests is that oftentimes we encounter unanticipated outcomes, delays that sometimes affect the outcomes of our approaches. No matter how well we, what our intentions are, sometimes they don't quite work as well as we think they are. So let's say a little bit more about systems. Everyone's a member of a family, and families are systems because there are multiple components. That's the definition. That's part of the definition. They're interconnected relationships, and they're coherently organized as to serve a purpose. So families are systems composed of individuals, connections, and they have a function. To have a meal together, to survive, to be healthy. And being healthy is a core function of a family. But the dynamics within families oftentimes produce health consequences that arise out of those interactions and behaviors in ways that are not healthy. And so the community health workers and others that I talk to, they suggest that you have to address the family as a whole unit to really address things like childhood obesity. Those that work with childhood obesity understand the importance of family dynamics in addressing how families make decisions about what to eat, when to eat, and how to eat. And often those family dynamics are associated with issues around self-image, body image, and other psychological factors that can also influence eating behaviors. So you can see, obesity and those things sort of arising out of these multiple decisions that aren't directly addressing obesity per se, but address all these things that drive obesity or overweight or unhealthiness in a household. A key insight about systems thinking is that the structure of systems drive behaviors. So here's a question. When you have a Slinky, and we've all had these as a toy, most of us, the question is, if you have the Slinky in your hand, what makes it bounce? Is it your hand or the right hand, your left hand, both hands? Well, the answer is that the Slinky itself makes the bounce happen. The central insight of systems approaches is that it recognizes that a system as a whole has a behavior, It sort of acts on its own. And that behavior is based on a structure. And that's why we say that the sum is greater than that the whole is the greater than the sum of its parts. Remember the animal parable? It's the same thing for all sorts of systems. You can't understand an elephant without understanding the whole, and you can't really understand the dynamics that address obesity without understanding all those drivers as a whole, the context. System structures, including this insight, include things like complex causes, no single solution, interdependency, and no linear cause-effect relationship. If you start looking at a phenomenon and you recognize that there are a bunch of different things that cause it, there's no single solution, there are many moving parts, it's probably a system. And if you notice certain kinds of behaviors, it's probably also a system. Oftentimes systems are characterized by resistance to change. You push one way and it pushes back. There are unintended consequences. You think that there's some sort of linear relationship, but there are circuitous relationships and there are delayed responses. Now, this is true in the obesity epidemic. This graphic is basically based on a model that's been used in a wide number of places. It was in the UK, for example, or in the States. Basically, obesity is driven by energy balance. We think about, the energy in is the food and the energy out, and the expenditure is our metabolism and physical activity. So at the center is obesity, but there are these systems that structure energy balance. We know that biology makes a difference, a little bit of a difference. Some people have higher metabolism. Some people may have certain genetic factors or that are associated with weight and metabolism, but those really aren't the main drivers according to scientists. Most scientists will say that it's food consumption and physical activity. But those things are also shaped by individual psychology. And when you think about food consumption and a meal, it's more complex than just what you eat. I mean, if you're a kid, for example, there are decisions about what goes into your diet. You may have plenty of things in your refrigerator that are not healthy that got there somehow and you're a kid. And so you think about these things as systems. There are a bunch of decisions that created that situation. And so even food consumption is shaped by drivers in the environment. If you're in a household in a neighborhood that lacks access to grocery stores with fresh and affordable produce, then it's very unlikely that your household will have food that's healthy for eating, and that can drive obesity. And so when we think about the whole perspective, we think about all of these systems. Individual psychology and social influences. We find now in the obesity epidemic that obesity itself is a disparity. It's itself a social determinant of health. People are having image problems because of the fact that there are everyone is telling them that they're overweight. And so how do these things impact our individual psychology and our energy balance? That's taking a whole systems approach. Let me give you an example of how you could take this complex systems approach down to earth into an actual community. And here we're going to be talking about the environmental drivers of physical inactivity. And I like to call this a local community ecology that shapes physical activity in a community. And so this is a case, this is basically a true story in Philadelphia. And what you see is a neighborhood that's sort of outlined in that sort of raspberry color. It's a working class neighborhood with high rates of physical inactivity. But what we find is that neighborhood is right adjacent to this amazing, beautiful park. It's Fairmount Park. And within that park is a historical trail, the Boxers Trail. And that's the trail that boxers used to run through. George Foreman, when he was training to box, ran through that trail. I'm sure Rocky, when he'd be on his way up to the steps in the Philadelphia Museum of Art, he went through that trail. But unfortunately, members of the community, and particularly children, were not going onto that trail, and they weren't going into that park. Now, I will say that that line on the that's perpendicular to the page that borders it, there's like a 6-lane highway with weird lights at the time. It was difficult to cross. And so, you might look at that from one perspective as an urban planner and say, let's do traffic calming and let's fix the street, and then people will just automatically walk over. But the community groups that we talked to, that the health department talked to, found a different story. This is what is known as a causal tree. And so basically what happened is that the community got together to think about what was causing the lack of people using the park, and particularly about the trail use. And so I won't say much about this. I'm going to focus mostly on the area in the yellow. But what they were saying was that they felt separate from the park, that they never really crossed in. They thought that there was something about the park that really wasn't for them. They didn't use the park because they didn't feel like it was a part of their community. When they thought about the park, they felt that it wasn't really desirable, particularly the trail. And so, and then of course there was the unsafe border that people were afraid to cross, but there were multiple factors, but those factors had their own causes. And so when you think about the trail use particularly, a lot of the members of the community said that they perceived that the trail as being unsafe, and so they didn't go to it. And one of the reasons that they didn't feel that it was safe was because there was a lot of litter on the ground, oftentimes nasty kind of litter that I'm not going to talk about. There was also, oftentimes people weren't using the trail, and so as a result, people felt unsafe. It's kind of scary walking on a trail with only one person like right behind you, sort of walking faster towards you. And so because the trail wasn't used, people didn't use them, which is a tautology. It's a sort of circular sort of thing. And so I'm going to demonstrate or illustrate exactly what I mean by a vicious cycle, because that's what was going on in this community. And we find this over and over again when we look at things in terms of systems. And that's why it's so difficult to address some of these problems. So on the left-hand side, what I've done is I've used what's known as a causal loop diagram. And so what we're interested in is trail use by the community. And you'll see these 2 red arrows. One is perceived trail safety. And when the trail is perceived as being safe, then people will use the trail. But if people aren't using the trail, then that means that there's less traffic in the trail, and so they'll think that it's not really safe. And so what I've described is a vicious cycle. But what we wanted to do is to try to find ways of shifting this dynamic, this system, this component of the system. And so you'll see that the trail desirability actually in itself affects the use of the trail. But even so, if people perceive it as being, unsafe, they're still not going to use it, and there's this vicious cycle. So how do we turn this vicious cycle into a virtuous cycle? So what we did was we focused on this issue of litter, and we also focused on the issue that there was this relationship between, or lack of a relationship at the time, between that neighborhood, the residents of that community, and the Parks and Recreation Department. The Parks and Recreation Department only did a cleaning maybe once a year, but it wasn't enough. And so what the community did was they began partnering with the Recreation Department in order to do a periodic cleanup that was run by the community with Recreation Department staff. And so what that did was it addressed the issue of litter, which we know impacts on trail use and the perceived safety of the trail, as well as the lack of people. And then it also got people into the trail. And so what it did was it addressed multiple components of the system. And this is what is known as identifying the leverage points and addressing those leverage points to shift the nature of the system. And it worked. People started coming to the park. They also fixed the traffic issue, and so they did some traffic calming. They put in some traffic lights, some stop lights, and that was helpful as well. But they also, as a result of this initial connection with the Parks and Recreation Department, developed a relationship that created more programming that the neighbors liked, and not just what everyone in Philadelphia liked, but something that the people that were right beside the park really liked. And so it completely changed the dynamic, and this is a success story. Physical activity levels increased in the community. So that was an example at the community level of a local ecological system. But these kinds of things happen all the time. It's a phenomenon that we see all the time when we look at things through a systems lens. And sometimes when you're a practitioner and you're developing interventions, you oftentimes lose sight of the big picture. And what I've described before as, this vicious cycle, that vicious cycle is known as an archetype, a systems archetype. This is another kind of archetype that you see displayed on your screen right now. It's known as short-term fixes that fail. And oftentimes this happens when we're not really thinking from a systems lens. We have a problem and then we fix it. We think that we fix it, but it's really a short-term fix, which doesn't really quite fix the problem. It fixes a little bit, but not completely. And so the problem remains. And at the same time, there may be a potential delay or some other unanticipated consequence of that short-term fix that, in fact, maintains the problem and keeps it in place. And so you wind up with a situation where the problem keeps being fixed by people who wind up without even knowing about it, without realizing that they're maintaining the situation in place. That's a question that people have that I talk to about obesity and the obesity epidemic. Are we in a situation where our fixes are failing? Are we really, really addressing the obesity epidemic in a way that addresses these systems that maintain us in a place where there's unhealthy eating, lack of physical inactivity, and other sorts of things? It's a question, but it's something that we have an opportunity to really look at what we're doing and reflect on at the Southern Obesity Summit. So let's say a little bit about the 13th Annual Southern Obesity Summit. Now, our Southern Obesity Summit is driven by the people who attend. If you're working in obesity and obesity prevention and you've got a great topic to work on, please send an abstract. We'd be happy for you to attend. But at this particular one, we'd also like to provide opportunities for learning about how to nurture a systems approach to obesity prevention. And so we'll have plenary sessions to inspire big thinking, whole thinking about the issue. We'll have pre-summit workshops to help tool you up in order to implement systems approaches to obesity prevention. We've always, at every obesity summit, worked to bring in non-traditional partners and non-health sectors, people like business owners, restaurant owners, and things like that. But we're going to take an extra step to bring on the people that people who work in obesity prevention often don't talk to. So we're going to be more welcoming to people outside of the health system and outside of prevention itself, like entrepreneurs generally. There are lots of people doing entrepreneurial work in public health and prevention that lend another perspective. Remember about the importance of looking at things from a whole. Having multiple perspectives is very important. So we're going to bring those folks. And we're also advocating that if you do submit an abstract, it would be really great if you were co-authoring abstract with some of these non-traditional partners and give these non-traditional partners an opportunity to present. We like hearing from public health practitioners. I'm one. But wouldn't it be interesting to hear the perspective of someone who works in farming? Would it be interesting to hear from the perspective of someone who is working directly with people with hunger, or someone who's really, really focused on social justice, but recognizes that there's an issue around weight gain and prejudice against people who are overweight that they really want to talk about? Let's do that for the Southern Obesity Summit. And then what we hope to do as a whole for the summit is to reframe and reset obesity prevention with a systems perspective. There are a lot of folks from the South that will be at this conference, this summit, And giving that, and I'm hoping that if just a few of those people shift their thinking and go back, we could probably have a greater impact on our efforts in the South. So let's think about presenting your work, but presenting your work with a focus on shared learning. That's a key part of systems thinking. How do you, even if you've done an intervention and it didn't quite work out, if you learn something that provides insight to someone else, you should be presenting that at the Southern Obesity Summit. It's always great to present your work, but we're also interested in thought pieces or case studies that describe not just how you did it, but what you got out of it, what you learned from it, how you changed a neighborhood, like what I just explained about this issue with parks in Philadelphia. It really shifted that dynamics. Were there any times when you shifted the dynamics of your work? We'd love to hear from you. And finally, the tracks are automatically sort of structured in the way that you'll be meeting people who are working with those systems drivers. You'll be meeting with the people that are working with food systems, and you'll be sharing a table, or you'll be watching some of the people, and I expect the audience will also be from those sectors. And so there'll be a greater opportunity for networking and discussion about these kinds of issues. So we're hoping to create a platform for learning to sort of emerge within the Southern Obesity Summit so we can help to shift those dynamics. So let me say a little bit about those tracks. And I'll go through them really fast, because if you go online, you'll see that these are the tracks that we've had for the Obesity Summit, but we just wanted to give you a few ideas. The first is healthy eating and food systems drivers. These are the systems that shape how we eat, what's on the table, what we have to buy. And so we're welcoming abstracts about food insecurity. I know that many people are in community health centers are recognizing that food insecurity is important in screening for it. Some are working with partners, and so if you're partnering with farmers or people that work in the food system, we'd love to hear your ideas on what you're doing. Farm to institution programs, looking at directly moving food from farms to hospitals, from farms to childcare centers, from farms to restaurants. Those are great kinds of initiatives that a lot of people would like to learn about. So if you're doing it, present it at the Southern Obesity Summit. Relationship building with food partners, the role of food entrepreneurs, which I've said before, food policy councils and other coalitions. Some of you are working on developing new kinds of coalitions around food, linking people that work directly in the food sector with people that work in the healthcare sector. If you've got a food policy council that's doing awesome work, particularly in the South, this would be great for you. A lot of people are thinking about behavioral economics and how do you create an environment like in a cafeteria, a school cafeteria, to sort of nudge students to sort of eat the healthy food and sort of put those ice creams and things sort of away in the back. If you're doing that in your school system, come to the Southern Obesity Summit and talk about it. And some people are doing things like policy work, like ensuring that there are nutrition standards in childcare centers. That's another sort of area. Active living and environmental drivers, those are the systems from land use planning and things like that that sort of shape the environment, both the built environment as well as the natural environment. They're both important. They're all linked together. And so some possible issue areas you might want to bring to the table at the Southern Obesity Summit is, again, cross-sectoral partnerships and relationship building that involves those leaders that shape those environments, people that work in land use planning, different kinds of people that work in planning departments, people that work in transportation departments, incorporating health elements in master comprehensive regional sustainability and transportation plans. Planning is one of the ways in which we can shape our environments. And if you've been working to incorporate health in ways that shape these environments, like making sure that there are bike paths and things like that, and you've got an experience that you'd like to share, this would be a great place to do it. Increasing the use of parks, playgrounds, and green space, improving walkability and active transportation. I think that we know what we mean by that. And then the unintended impact of healthy design on health equity and social justice. What I've heard from many people is that this is one of those other unintended consequences. When you improve the built environment, are you just making it easy to, are you just inflating the housing costs? Are you, helping to gentrify the neighborhood? Are you exacerbating existing health disparities? How can we, at the onset, if we are going to change the design of the community, ensure that it serves multiple purposes, that it not only improves activity for everyone, but it also focuses on those communities that really need it? Social forces and individual psychology. Now, many people are focused on these kinds of issues that are health educators, looking at counter-messaging strategies and, looking at the negative media exposure because we're inundated with media. Some of you are doing some awesome work around this, and we'd like to hear from you. But we're also interested in hearing, again, this is one of those thought pieces, your perspective on this whole issue of the weight-dominant health paradigm and the fact that we've created, we've conceptualized obesity as a disease, but is there an unintended consequence to doing that? Does that just magnify an existing disparities and inequities against people who are overweight by making it a clinical issue as opposed to something that arises out of a system? We'd like to hear from you about that. These are those big issues that are really important that we oftentimes don't hear. And then another issue that we're hearing at the Texas Health Institute is the role of obesity policy inertia at really challenging practitioners at finding funding, finding support, putting things in the policy agendas of people who, of decision makers and at the local and state level, that it seems like despite the fact that obesity is extremely costly, it's associated with lots of chronic diseases, people are starting to lose interest in it. And there's a lot of research out showing that this is an actual thing. If you've been doing research on that, or you'd like to share your perspective on those dynamics, this would also be a place to do it. And things like body image and eating disorders, those are also sort of individual psychological issues that should be talked about. And then some people are looking at obesity from a global perspective. And now obesity is seen as having gone through multiple transitions, starting in the States and in higher income countries, but now it's everywhere. And in lower and middle income countries, we see obesity with malnutrition at the same time. And then in places like the US, we're seeing, well, we've sort of look like we might be stabilizing it, but we're stabilizing it in a high place. We're in a different place in the transition. If you think about those global kind of issues, I think that everyone should be hearing about that. So those are the systems drivers, and those are the tracks that if you're interested, you can do that. But biology is important. And I know that we like to talk about prevention, but when I think about HIV prevention, I can't imagine anyone talking about HIV prevention without PrEP. In the same way, I'm wondering, we remember fen-phen? We've gotten away from those things, but are there some new kinds of medical things or oral drug agents that are coming out that might change the dynamic? What about issues around behavioral health and the relationship between mental health and more likely to be obese? They call them weight gaining drugs. And there's research on early childhood trauma and later obesity. There's new information and research on the impact of epigenetics and the microbiota in obesity. So these are things that 10 years from now might completely change the game. But we want to make sure that practitioners know this right now so they can prepare for it. So please share your thoughts on that. And also, please share your thoughts on maternal health and breastfeeding, which has a big impact on not just later obesity, but overall health for both the mother and the child. And also, maybe it has impacts over multiple generations. Now, local ecological systems, if you've been working locally, as many of us are, but you'd like to sort of share your experience, this is the place to do it. It's sort of anything goes kind of track with a focus on experience with implementing policy systems and environmental change strategies, using systems design thinking for community transformation, lessons learned, transdisciplinary and cross-sectoral collaboration. The last one, this local ecological system, the example that I gave you with Philadelphia, that would have been a perfect place to talk about those things. And then finally, the last track is systems approaches to state and national policy change. And again, these are really about case studies or people's perspective on moving the policy agenda around addressing the obesity epidemic. So possible issue areas include regional, cross-jurisdictional, or multi-state challenges and strategies that may be happening with a bunch of people across the country, but no one really knows about it. Well, this is an opportunity to share. Mapping systems dynamics in southern states. Is anyone actually doing these causal loop diagrams in the South, in any place in the South? We'd love to hear from you. And then using a systems lens to learn from unsuccessful policy changes. I think I mentioned that. And then, of course, incorporating multi-sectoral actions at the state level. Many states, including Texas, have passed legislation to create these multi-sectoral coalitions or groups that include, the agricultural department, the state health department, and so forth, to try to address obesity and healthy eating. This is a section for you if you'd like to share that. So I'm going to turn it over to Stephanie and my co-director, as well as our ED, to field your questions. And so first, Stephanie, are there any questions from the chat box that anyone had?
Not as of yet.
Okay. So if you have any questions on the content, or if you have any questions about the tracks, the process for submitting tracks, or the Obesity Summit and what to expect from the Obesity Summit and how to register, or things like that, this is an opportunity to ask those questions. And please use the chat box. If you go and click on, there's a little box that clicks on, that when you sort of move your arrow or mouse over it, it will open up and you'll see something that says chat. And you can open up that and then send to the presenter, the panelists. Okay, I see one. Yes, I see one question. Will the format still be 15-minute presentations grouped together in 4-hour blocks? Stephanie, can?
So absolutely. So it'll actually be an hour and 15 minutes for each block. And each of those 6 tracks will have 3 presentations each. So each person that presents within that one block will get the 15 minutes. And then at the end, there'll be a total of 30 minutes, with the idea that each presenter receives 10 minutes of Q&A per.
So let me just repeat that.
Yeah.
So 3 speakers per session. Each speaker gets 15 minutes. And the rest of the time, and how long is the whole entire session?
So the total is an hour and 15 minutes.
Okay, so an hour and 15 minutes. So that means 45 minutes for the presentation and 30 minutes for Q&A and discussion. And I think that is going to allow the opportunity for interesting discussion to arise. Any more questions? Please use the chat box if you have any questions. I just want to let you know that we're interested in hearing from you about how you learned about this. And I think that we could probably send out an evaluation afterwards.
For the webinar itself?
Yes.
Sure.
Yes.
Did you see the next question about system changes?
No, I didn't.
Okay.
I
Did you want me to read it?
Yes, please do.
So system changes with impact on obesity usually require funding, restating PE in schools for middle and high school students. Is information on funding policies, strategies, and models going to be included in the system areas? Yeah,
the answer is yes. And since you brought it up, that is something that we can ensure that there's a speaker to talk about it, because, you're right. A lot of what we do in public health is driven by funding, and the dynamics that we see in public health, and I've seen it all my life, is that we tend to go towards the shiny new thing with funding at the expense of other things when we've not really fixed the problem. But the question is, how do we deal with this issue about funding from a systems perspective? I mean, we've been thinking about this for my entire career in chronic disease prevention. We've been thinking about how do we get a steady stream of funding for chronic disease prevention and public health forever. And so, yeah, that's a perfect topic for discussion. And we do want to bring those things out in this summit. So thank you for that question. Okay, any questions about submitting abstracts? We are opening up registration on
next week.
Next week. Mm-hmm. So please look out for the registration link on the Southern Obesity Summit website, which is southernobesitysummit.org.
Mm-hmm. And as a presenter, as an accepted presenter, you receive a $50 discount.
Oh, I'm going to continue with my commercial. If you are a presenter, if you submit an abstract and you're a presenter, then you will get a $50 discount on your registration. So seeing more questions, maybe we can, I'm going to turn it over to Ankit to close it up.
Sure, Ken. Thank you so much. Again, thanks for a wonderful presentation and kind of taking a deeper dive in a more illustrative way for what do we mean when we say we want to introduce systems approach to obesity prevention and moving the needle on the issue here in the South US. I'm excited and looking forward to reviewing the proposals as well as just in general waiting and excited for the summit. Again, for those of you who were able to join us in between or who could not join but have registered, we will have this webinar. We're recording this webinar and we'll have it shared through our website as well as listserv. But in the meantime, if you have any questions for us, be it related to the request for proposals or also for the summit registration itself, please don't hesitate to reach out to one of our co-directors for the summit, Dr. Kenneth Smith. His email is the first one on your screen, and then right at the bottom is Ms. Stephanie Andreas. It's her email. Both, again, we will be happy to answer any questions. We do definitely look forward to seeing you attend the Southern Obesity Summit and learn from you in that process of what does it really mean to come together and move together as a system towards obesity prevention. Do want to thank each one of you for taking the time to join us on the webinar today. And we hope that it was productive for you and we helped you think differently and expanded the thinking in the way we not only pursue obesity prevention, but also we perceive our work and our role in that journey. So again, thank you so much for your time.